Hello everyone, welcome back to my channel. Have you ever heard of another condition called encephalitis before? Well, encephalitis is another serious one that you need not to take lightly. So let's get into the video what encephalitis is all about. So first of all, someone may ask, what is encephalitis in the first place? So encephalitis is an inflammation of the brain tissues, okay, usually caused by viral or bacterial infections. Okay, so that's a serious one there, right? Okay, so someone may ask again, what are the causes of this encephalitis, this medical condition? Well, from the definition, we made mention of the fact that it is actually caused by some viruses and then some bacterials. Okay, so let's get into some of the causes. Obviously, the first one has to do with viral infections. The second cause has to do with bacterial infections. Okay, and then the third one has to do with when there is parasitic infections. And then the fourth one has to do with autoimmune disorders. Okay, example has to do with the autoimmune encephalitis. All right, so the final cause has to do with TBI, which I have already made a video on. Now, let's get into the risk factors. I'm going to give you 5 risk factors, and these ones are more of common. So the first one has to do with age, most especially in children and then the elderly. This condition is common most especially in the children and then that of the elderly people, irrespective of your gender. And then that of the second risk factor has to do with weakened immune system. The third one has to do with travel to endemic areas. You are at a higher risk of having this condition also. And then the fourth one has to do with exposure to mosquitoes. Okay, exposure to mosquitoes can also cause this one. And then the fifth one has to do with the history of viral or bacterial infections. Okay, all right. So someone may ask, what are some of the possible signs and then symptoms to look out for? The first one has to do with fever. When you feel feverish, there is a high possibility that you may have this condition. And then the second one has to do with headache. The third one has to do with confusion. The fourth one has to do with seizures. The fifth one has to do with weaknesses. I mean, in some of your limbs and then basically your body parts. Yes. And then the sixth one has to do with sensory disturbances. The seventh one has to do with difficulty speaking or swallowing. Okay. Yes. And then the eighth one has to do with loss of coordination. Yes. So those are the signs and then symptoms of encephalitis. And then the role of physiotherapy is as follows. Yes, so as I said, I am a student physiotherapist, and then when I don't say anything about the role of physiotherapy in managing these conditions, I think the video is not going to end. So let's get into the video. Now, the first thing that as a physiotherapist you will consider is to, one, educate the patient on the condition and on proper posture and then proper body mechanics. Okay, and then also tell the patient the role of physiotherapy in rehabilitating or treating this condition. And then we also have second one being assessment. So we do assessments on the cognitive, the physical, and then the functional evaluations. Okay, the exercise programs. We bring in exercise programs such as aerobic, strength training, and then flexibility exercises. This is to enhance adequate mobilities. The third one has to do with mobility aids training. Okay, yes, and then that is the use of these assistive devices to, enable you perform some ambulations and then extra movements within the various parts of the body. And then the fourth one has to do with transfer training. And then the final one has to do with activities of daily living training. Okay, you will be trained so you can come back to those activities that you lost as a result of the condition. Yes, so this brings me to the end of the video. Don't forget to subscribe, like, comment, and share. And see you next time in the next video. You can drop your suggestions and anything you have in mind in the comment section, and I will surely respond to you. See you next time. Bye.